Lymphedema and other lymphatic system conditions are known to be lifelong and don't currently have a cure. They have been managed over the years with compression, lymphatic drainage, and other conservative treatments. Now, lymphatic and lymphedema surgeries are becoming more widely available around the United States and around the world. What are these surgeries and how do they help with lymphedema? My name is Kelly. I am a physical therapist and a certified lymphedema therapist. Today in this video, I'm going to share more about what the main surgeries are for lymphedema as of now and how they work. Before we begin, make sure that you subscribe down below for weekly new videos, and you can also follow along with us on Instagram and check out our website for more related content. So we're going to talk about the three most widely used surgeries. There are many different versions and each surgeon has his or her own technique and protocol. So the best way to learn specific details and also any personalized medical advice would be to meet with a surgeon who does these surgeries. They are often referred to as super microsurgeons now because of these very detailed procedures. They will usually do an ICG test where dye is injected right below the skin, either in the hand or in the foot, and then tracked and followed as that dye moves up the lymphatic vessels in the legs or the arms. This allows surgeons and doctors to see if there's any backup of the system, where it is, and how severe it may be. With all of this, it will help to diagnose, but also help guide the best treatment plan. The first surgery is a suction-assisted lipectomy, which is a procedure that removes excess solid or thickened fibrosis from an arm or leg. Lymphedema that has been present for a long period of time may cause hardening or thickening of that fluid and tissue in the limb. Conservative therapy like compression bandaging, garments, lymphatic drainage, and others are no longer going to work well or be effective for this kind of tissue and fluid changes. So the best route then is to remove it. It may be with surgery. A suction-assisted lipectomy may be done to remove these solids in the limb. This procedure allows for immediate reduction in the size of the arm or the leg and also helps to soften the arm or the leg to a reasonable degree. But what happens after? Well, the lymphatic dysfunction or issues is likely still present. Someone will need to continue to wear good compression after and be diligent about care to avoid building up again. But often when the solid and that thick component are removed, the lymphatic fluid may drain and move out of the area better, which can help improve lymphedema or lymphatic conditions. Another positive of this surgery is that infections such as cellulitis are shown to decrease by about 80%, which is an extremely significant amount for overall health. Lastly, with the reduction in volume and in the solids, someone may have a better range of motion and ability to move around, less pain, and overall better quality of life. The second surgery that is gaining popularity quickly is a lymphovenous estimosis, or an LVA. This super microsurgery involves connecting a lymphatic vessel to a nearby vein to allow fluid to move through and out of the area that is congested or not flowing properly. This is where that ICG procedure comes into play as well for planning, as a surgeon can see exactly where the fluid isn't moving and can follow the color dye through the procedure to make sure there is an effective connection and that fluid is now moving. Lymphatic channels are around 0.5 to 0.8 millimeters in size. Veins are slightly larger. This is a very detailed and precise procedure to take the lymphatic vessel and connect it to a vein. But if it's successful, the lymphatic fluid has a way to flow and move, and this can significantly improve swelling in the area. Surgeons will often find or try to find multiple connections, not just one, during the surgery. This surgery has also been shown to significantly reduce cellulitis and infections as well. One thing to note per a surgeon I spoke with is that this is a great procedure to move fluid, but it likely won't reduce all that chronic hard or solid fluid and tissue inside. So many may have that suction-assisted lipectomy first and then return for the LVA after. After surgery, one will need to wear good compression to support the arm or the leg and refrain from any vigorous activity for a handful of weeks. Each surgeon has his or her own protocol to follow, so the best thing to do is speak with the surgeon of the details of when it's safe to return to normal activity and work with a certified lymphedema therapist and as well as the surgeon on the best kind of compression to be wearing and to have on for the best surgical outcome in the long term. And then the last surgery I'm going to talk about in this video is vascularized lymph node transfer, or VLNT. A VLNT takes healthy lymph nodes from another area of the body and transfers them to the limb or the leg or the part of the body that has that dysfunction, lymphedema, or has no flow through the lymphatic vessels. This is most often used for those who primarily had healthy, regular lymphatic system and then maybe had lymph nodes removed or radiated for something like cancer treatment. A lymph node transfer is often done alongside an LVA or as an addition to help support the lymphatic system. There is some processing and discussion on the exact way that VLNT works to help, but most often it's thought to absorb and take in that lymphatic fluid in the area that has that backflow and redirects it into a vein or the vascular system. There is some concern about the risk of lymphedema in the arm or the leg that is the donor site for lymph nodes, like where the lymph nodes come from that are transferred. But this is something that is mapped out really carefully by the surgeons to prevent, and the rate of this new lymphedema occurring is very low. This surgery, like the others, reduces the rate of cellulitis and infection. It reduces the volume and the size of the limb, and it can improve your function and quality of life. So those are the main 3 surgeries that are being done at this time. There are other procedures surgeons may be completing, and it's best to meet and connect with them for individualized treatment. Again, for other content and topics related to lymphedema and the lymphatic system, be sure to subscribe down below, and we'll see you all in the next video. Thanks, everyone.